already passed. One sees danger coming way too fast. One bends the frame so the truth can breathe. Trying to help the mind find peace. We are the mighty ruminators, living in the past and future at the same time. Searching through the echoes, trying to make sense of every sign. Thoughts get loud, world spins fast. Some things stay too long when they should pass. But maybe clarity begins.
I see you. Welcome on in. Welcome on in. We're just getting started. Let me post it up.
Not every thought needs a home. Not every feeling needs a fight. Sometimes the mind.
Miss Luna, I see you. Blessed Believer, I see you. Jason, I see you. That was one of the songs that L made me. Hold on. Let me play it again. As we all know, we are liking the live. We are reposting. We are grabbing a daily heart me. Once we get to 6K likes, we're gonna go ahead and get started. Let me go ahead and post it to my story and send it to my guests.
In the city where the thoughts don't sleep, where the silence talks and the shadows think, past the future pull at the seams, turning little worries into giant things. One keeps replaying what already passed. One sees danger coming way too fast. One bends the frame so the truth can breathe. Trying to help the mind find peace. We are the mighty ruminators, living in the past and future at the same time. Searching through the echoes, trying to make sense of every sign. Thoughts get loud, world spins fast. Some things stay too long when they should pass. But maybe clarity begins the moment we finally notice what's happening inside.
Okay, we good. Miss Luna, I see you. Welcome on in. Something you could use. I see you. Welcome on in.
A little more light.
You guys, that was a song that L made for me and pals. So this is just a brief, a soft launch. Is my thing working? Okay, we good. Everybody, hold on. I gotta keep playing it again. I have two songs I'm gonna be playing for you guys today. As we all know, we are Her Divine Alchemy. Her Divine, listen. We are grabbing our daily heart meet. We are liking the live. Once we hit 6K likes, we're gonna go ahead and get started on our trending topic in healthcare. L, did you hear me playing the song? Let me pull my questions up. Hold on, y'all. L, I see you. Her Divine, I see you. Did I post it to my story? Can somebody check if I posted it to my story? I can't remember. You know, I do like this song too. Good evening. You know, somebody made it from me. Somebody made it from me. I like this one too. You guys, we are getting to 6K likes. Once we get to 6K likes, we're gonna go ahead and get started. Okay. She said she reported for duty. Are y'all reporting for duty too? We are grabbing a daily heart. We are liking the live. Something you could use. I see you liking the live. I appreciate you. Once we get to 6K likes, y'all know the drill. Once we get to 6K likes, we're gonna get started. Hold on, let me play my other one. Let me just go back and forth. Let me go back and forth today. Eve Rose, I see you. Welcome on in. You made it just in time. Dr. Michelle, I see you. CM Thompson, I see you. As we all know, we are going to go through our, we're going to do our trending topic in healthcare. Then we're going to do our interviewed guests. And then we're going to wrap it up with Professor Tips. Once again, we're doing our trending topic in healthcare. We're going to do our interviewed guests. It's a very great guest today. All the guests are great. You know, all of the guests are great. So another great guest. And then we're going to wrap it up with Professor Tips. But in the meantime, we're getting to 6K likes. We are grabbing our daily heart meat. We are reposting. We are yeah. I see Dr. Michelle. I see you sharing out the live. I appreciate you. El Meek. I see you. Everybody. We just typing in reporting for duty. This song right here, El made this song, and the other one I was just playing, Her Divine Alchemy in the audience made that song too. This is what community is all about. Okay, folks be making you a song, and I appreciate them because they didn't have to. But you know what? You see, when I upload my videos over to YouTube, I have no more copywriting issues because I have my original music brought to you by El Meek and Her Divine Alchemy. Let's continue.
The mind find peace. We are the mighty ruminators, living in the past and future at the same time. Searching through the echoes, trying to make sense of every sign. Thoughts get loud, world spins fast. Some things stay too long when they should pass. But maybe clarity begins the moment we finally notice what's happening inside. Not every thought needs a home. Not every feeling needs a fight. Sometimes the mind just needs a little more light.
Okay, we almost there. 5.7K. I see you guys. Let me put the headphones after. I'm ready to get started. The music pause. Okay, while we waiting for the damn, you guys already got me there. Hold on, there's 2 more minutes. Let's finish up this one.
The people alive and the doctor right. Research on the table, knowledge on the floor. Breaking down the system at the AFK door. Mind body spirit covers all to the antidote to everything they don't want us to be. Dr. Johnson, we live in the room. Black excellence living on the culture in bloom. Raise it up, raise it up. The culture alive and the doctor right. Raise it up, raise it up. The culture alive and the doctor right.
Everybody, welcome to Office Hours with Dr. Johnson. Today, I was going to do one song in the beginning and one song at the end, but now, because I want to make sure that, you guys see the greatness that was made for me that I appreciate so much. So shout out to Her Divine Alchemy and shout out to El Meek for the 2 songs that they made me. I no longer have copywriting issues. So everybody, welcome to Office Hours with Dr. Johnson. Today's going to be a good day. Miss Nike, I see you. Welcome on in. We're just about to get started. We're going to discuss the trending topic in healthcare for today. As you guys know, my trending topic in healthcare, I breeze through them. I don't like to stay on it too long because I like to dedicate the time to the interview guests. That's my bread and butter. My guest. I mean, who else out here? Wait, so why are people sending me an invite to co-host? Oh, decline. Not today. I mean, who else out here with their own theme songs dropping back? Hello, and I have my ghostwriters and my producers in the chat too. My ghostwriters and my producers are Her Divine and El Meek. Hello, you right. Let's get started. Okay, trending topic in healthcare. Is that still here? Do I gotta type it? So the trending topic in healthcare that I want to briefly discuss with you guys. I'm sure some of you guys have heard about it. The FDA. Yeah, last week was another FDA situation. Now, it's just going to continue with the FDA, okay? The FDA is planning to review access to peptides. We all know what peptides are. Ms. Nagasi, before we continue, thumbs up, praying hands is me acknowledging you guys in the chat. I see you. Thank you so much for all the support. Thank you so much for all the gifts in advance. I appreciate you guys all. I'm not ignoring you guys. Y'all know the drill. Thumbs up, praying hands. I'm shouting y'all out, okay? So once again, we hitting it again with the FDA. The FDA is going to review access to peptides. We all know what peptides are, right? Dr. Selena, welcome on in. I see you. We're briefly discussing a trending topic in healthcare. It is the FDA is planning to review access to peptides. So briefly just want to discuss with you guys and drop down in the chat. Do we all know what peptides are? Have we heard of peptides? Do we know anybody who takes peptides? Okay. So the FDA will soon review whether certain peptides should be allowed in customized medications made by compounding pharmacies. Anybody in the chat, do we know anybody who has taken peptides or know somebody who is considering peptides or currently on peptides? I know a couple people on peptides. It's one of the new things. They're using it for like weight loss specifically and also some hair, skin, and nails. Anybody in the chat on peptides or know somebody on peptides? Before I continue, we know we're briefly going through it. So peptides are a small chain of amino acids that are marketed for a wide range of uses, including treating wounds, obesity, insomnia, and inflammatory conditions. Okay. An FDA advisory panel, which is set to be in July. That's in May, June, July. That's about to be in 2 months. They're about to review this. An FDA advisory panel is set to meet in late July, where they're going to be reviewing, can we make this public? Because right now it is not, peptides are not FDA approved. So all these folks who you hear and see who are taking peptides, they're just taking it at their own free will. It is not FDA approved. But then again, sometimes we're not even going to get into that. This action begins to restore regulated access and will immediately begin shifting demand away from the black market. Yes, peptides are technically on the black market. Oh, what did Luna say? Heard about them, but not sure. Right now, the demand is for weight loss. I did discuss how obesity, instead of doing like semaglutide, aka Ozempic, or Mounjaro, tirzepatide, Zepbound, a lot of people are using it in replace of that because it is slightly better. Hey, I'm not promoting this or telling you guys to go out there and take it, but they're saying that the peptides from their own personal research is a little bit better than those GLP-1s. Okay, however, there are other peptides that are good for hair, skin, and nails, and other peptides that are good for insomnia, and other peptides that are good for if you're having inflammatory issues. Come July, they will review peptides to possibly, be sold to the public. I want to make sure I choose my words wisely because, everybody, there are some people who are like, I like the natural route. I'd rather go to the gym. I'd rather, change my lifestyle. I'd rather eat healthy. I'd rather, just take a holistic approach. And then there's other people who are like, hey, I don't have no issues with, taking a foreign substance and, helping it boost my metabolism to give me that kickstart to lose weight. So it's 50-50. Once again, we're just discussing the information. We're nothing promoting here. You guys know the trending topic in healthcare is just to share with you guys what's going on. Okay, because there's a lot going on. Okay, peptides are already used in some approved medicines such as insulin and certain weight loss medications. We can't say the D word. Okay, so it's already being used in some. However, after this review by the FDA advisory board, it could be on a wider spread level. Okay. So be on the lookout for peptides, you guys, but also make sure we're doing our research, okay? Is one of my moderators still here? Elle, you still here? Let's bring up our guest. One second. Can you guys hear me? Thumbs up in the chat. How is the audio?
I can hear you.
Okay, we can't see you, Dr. Michelle. Can you guys, how is the audio? Crystal, I see you. Welcome on in. Thumbs up in the chat if the audio is good. Let me put both my headphones before I get started.
So I've never
Okay,
been live before, so I don't even know how to turn on my camera.
Oh, guess what, Dr. Michelle? There's Oh,
I'll
Dr.
figure it out.
Selena, I see you. Okay, you guys know I'm not a TikToker. You guys know, can we help out my guest real quick? How did she turn her camera on? Dr. Michelle, you see,
Okay, hold on.
okay, I think I just sent you the camera. Okay.
Yeah, I see it. Give me 1 second. Gotta get my life together.
You good. Take your time. You've been in a couple of my office hours. You're in a safe space. I got you. Nothing for you to be nervous about. Nothing for you to,
Of
we're,
course.
okay. Yes, miss.
Just give me a second. I'll be on in a minute.
Okay, okay. Crystal, I see you. Crystal, thank you so much for being here, Crystal. I'm gonna send you a message, Crystal. We're gonna talk about a few things, but I hope you're doing well, Crystal, and you're taking your time to, be well. Wait, Dr. Selena. Okay, shout out to you, Dr. Selena. I see you in the chat. You know what? The algorithm be algorithm. Doctor, I don't know if Dr. Selena's still here, but your couple of your videos was popping up on my algorithm. Okay, and look at you. You're in my chat today. Dr. Selena, I'm gonna send you a follow back. So you guys, today we're going to be interviewing Dr. Michelle. She is a doctor of behavioral health. As we all know, we are wrapping up Mental Health Awareness Month. Okay, and my each of my guests for the month of May were somebody who worked within the mental health space. So for the last interview of the month of May, we're going to be discussing the work that she does and the different areas in which she has pivoted. And I want her to share her professional skills and certifications, and also the practice that she owns. So we're going to be getting into various aspects of mental health and behavioral health today. Ash, I see you. Welcome on in. I know, Crystal, you missed a whole month, Crystal, but guess what? Life be life, and guess what? It's all right. We definitely understand, Crystal. Dr. Michelle, you good? You could
Yeah, I'm coming on. I was trying to figure out how to do this the best way.
hold on.
I'm on my iPad.
Did you see the request? Did it send you a request? Oh, there we go.
Yeah,
Okay.
there we go.
Okay, perfect. Thumbs up in the chat once again. Can everybody hear her? Can everybody hear me before we get started, before we continue? Because we're going to take it there. Just another thumb. Pals, I see you. Welcome on in. She is. Okay. She is. And you know, I'm out. Takia, I see you. Welcome on in. Takia is my number one TV host review. Takia is, let me tell you what Takia is, y'all. Takia is the new Wendy Williams on TikTok. Okay. Takia is our new Wendy Williams. So shout out to you, Takia. I see you. Um, Dr. Michelle, thank you so much for being here. Thank you so much for taking the time to step into office hours with Dr. Johnson. I know you're busy. I know you have a lot going on. So we're going to jump right into it. As you know how we do this, briefly, educational and professional background. Obviously, you know this is social media, so whatever names you don't feel comfortable sharing, we all know how to understand context clues. So once again, educational background, professional background, what you got going on? Who are you?
Okay.
Who is Dr. Michelle? Let us know briefly.
No problem. Sorry, guys, for that technical difficulties. So I'm Dr. Michelle Francis. I'm a doctor of behavioral health, as Dr. Johnson explained. So with behavioral health, it mixes mental health with primary medical care. So I do a mixture of both, primarily the mental health, because I am a licensed therapist by trade. So I'm licensed in Florida, Texas, and Massachusetts, and soon to be Indiana. So, in terms of education as well, I went to Florida Atlantic University. I also rep Florida State because I went for a little bit. I didn't graduate from FSU, but I still claim it. So I went to FAU for bachelor's and master's, and then I went to Cummins Graduate Institute for my doctorate. And I completed my doctorate last year, last February actually. I walked across the stage last May in Arizona, so that was very, very exciting. So in terms of professional, I'm a forensic social worker by day. So that means I work with incarcerated individuals. Everyone that I work with have some type of substance use problem, specifically opiate use disorder. So the goal is to help them get back into the community, reduce recidivism, because the minute they get out, they're more likely to go back in. So that's where myself and my team comes in to try to do some interventions. So I also have my own private practice. It's called Pinnacle Clinical Solutions. So in my practice, that's where I do see the individuals in Florida, Texas, and Massachusetts for mental health counseling. I have an office here in Central Florida. So I'm located in Central Florida. But anyone else in the state of Florida, Texas, or Mass, if you want services, I do accept insurance. And I also do private pay. So if you want to reach out to me, you can go on my page and you can reach out for a consult. My phone number is on there. My website is on there. Everything is on there. So TikTok is kind of new for me. I've been on it, I want to say less than a year. It's been less than a year, but I was just watching. I was like, I am not getting sucked into the whole TikTok thing. Very educational, but also can be a little toxic depending on who you're getting your information from. And I try to remain as clear as I can. So, but I've been on TikTok. Actually, TikTok helped me through my mental health journey, if I'm being quite honest. So it's interesting
Okay.
we're talking about mental health because for the longest time, even though I'm a therapist and I'm pro therapy, of course,
Right.
I always said I'm not ready to see a therapist. Like I already know what they're gonna tell me. I know my coping skills. I know my problems. Yada yada yada. So yes, I know all of that, but it's not the same until you have a clinician who you can actually talk to. So I was going through a hard time, and TikTok was along with therapy. So I did go see a therapist. I'm still seeing him. So that along with TikTok sometimes just to take my mind off of things because like
Right.
Dr. Johnson say, I do work a lot. Um,
Right.
Outside, if I wasn't on here right now, it would be with an intern helping them with their supervision. So sometimes social media does come in handy, even if it's for a deflection, something you're
Right.
trying to keep your mind off of.
Right.
So yeah, in terms of my professional, I like to say I'm a very down to earth therapist. Like I do challenge my clients for sure, but I meet them where they are. I don't really necessarily push if they don't want to talk about it, but eventually we are going to get there.
Right.
But I meet them where they are. So that's just a little bit about me.
I, I love that. I love that breakdown, Dr. Michelle Francis. Okay, I got to say her full name, and she also left out one important thing. She come from the same place I come from. She come from Jamaica. I don't know why
Yes.
she did it. I don't know why she didn't just drop it on us real quick. Like she come from the 876. She couldn't even tell us what parish she come from.
Sorry, my
So
bad. So
yeah, yeah. So tell the people then which parish you come from.
yeah, so I am from Jamaica. I was born
Yeah,
in
okay,
Jamaica, so real, real,
okay,
real yachty.
okay,
Um, I'm from Mandeville, Manchester,
okay.
the
Why?
parish.
Why?
So
Why?
Mandeville.
Why? Why?
Yes.
I didn't know you was from Mandeville. Why? Let's
Wait, are
continue.
you close? Are you
No,
close by?
I'm from Brownstown. You know Brownstown
Okay.
in St. Anne?
We don't have
You
to
know
talk about.
Okay, yes, ma'am, yes, ma'am. It's getting it's getting local. You see, it's getting local. It's getting local. Mac, I see you. Welcome on in. Thank you so much for being here. I see you guys dropping the Jamaican flag. So everybody just joining on in. Today we're interviewing subject matter expert Dr. Michelle Francis. She is a doctor of behavioral health and also a licensed clinical social worker. Okay, and it's funny how she mentioned that she's also a qualified supervisor. We were supposed to have this interview couple weeks ago, but she had work to do. She had to supervise her interns. Okay, so when she says she really be working. And she was like, Dr. Johnson, I'm busy. But Dr. Johnson, these are my dates.
Hmm.
And today, and it just so happened, God is so good. Today's the last Tuesday of the month of May, and I got to have the Dr. Michelle Francis come on over here and drop some gems. So, Dr. Michelle, I want to bring it back in real quick, okay? What first inspired you to pursue behavioral health and social work?
So, I always knew I wanted to go into a helping
Okay,
profession. So at first I wanted to be a nurse like every other Caribbean girl
okay,
because that's what we were expected to do in a way. My family didn't push me or force me to do anything, but it was almost like an unwritten statement like we're going to school, especially because my high school was a health sciences high school, so I was in the magnet program and everything and taking the it's like you could become a CNA by the time you graduate. So I did all
right.
of that. And then I started college with the nursing major, but I just didn't like it. I could not get with it. Oh,
Sorry. It's yeah. I'm so sorry, yo. Please, we're dealing with another first timer. We're dealing with we gotta think. Sorry about that. Okay, that's them
it's
just
okay. I was just
that's
trying.
them sending in their support and sending in their
Okay.
appreciation. Yeah. So you a
Okay.
healthcare professional. You know how to multitask and block out the
Yes,
noise.
for sure, for sure.
Yes, ma'am. Okay, ma'am. Tap in, ma'am. Tap in.
So nursing was not for me, so I decided to actually change my major in my bachelor's level to criminal justice,
Okay.
actually. So my
Okay.
bachelor's is in criminal justice because I had this great idea that I was going to focus on, well, in a way it worked out, recidivism. Like I don't want to
Mm-hmm.
help, I want to help people stay out of jail. So that was the goal. I finished my undergrad, and then
it was that moment, like, do I go get a job now? Do I go to grad school? So I was applying for a few jobs, no callbacks, but I will say I didn't apply for a lot. So I'm not going to make it seem
Okay.
like my job search was crazy to the point where I gave up. It wasn't like that. It was more so, all right, I'm gonna apply for jobs, but I was working a good enough job at that time. I was
Mm-hmm.
still living with my parents and stuff, so bills were not the same as it is right now, as I'm on my own, right? So I applied for grad school. I only applied for one. Sadly, I'm just gonna tell the truth. I didn't want to take the GRE. And at that time, FAU did not need the GRE for you to apply for their grad school. So I took it. And I mean, I didn't take it, I applied. And I got in first. If I didn't get in, I did plan to study for the GRE and apply for others, but I didn't need
Right.
to. So social work. How did I choose social work? It was my master's was going to be between criminology or social work. So
Okay.
I weighed pros and cons. And
Mm-hmm.
for me, what stood out with the social work, I just felt like it was more broad. Like I had more options
Mm-hmm.
compared to criminology. That could just be my own thing. Similar to why I got my doctorate in behavioral health and not my DSW. I
Right.
just, to me, my opinion, please, just my opinion, that the DSW is a little bit limited and it's more clinical focus, where the behavioral health doctorate, it's a broader and I could go into different things.
Right.
So yeah, that's how I came about with social work. I always like love helping people,
Mm-hmm.
and it just came natural. Like I know how to talk to people easily. People just pour their hearts out when I don't even know you. So I was like, it kind of just worked. And so that's how I got into social work. And then with my passion for social work growing over the years, it was just natural that I found something in behavioral health to stick to it.
I love that. I love how you give that breakdown. And I love how you were also transparent because here in my office hours, I'm always telling people, hey, do not be afraid to change your major. Do not be afraid to start this job or start this major. Feel it out. If you don't like it, switch. You
Yes.
One thing I always want to make sure I debunk people, they always feel as though that once they start something, whether that's a major in school or a job, they're stuck. Hey,
Yes.
wait. And us Caribbean folks and our parents, they hit us with the spirit of complacency. We're not
Yeah.
gonna take it there. Okay, let's continue.
Right.
Crystal in the chat said we gotta pivot. I wanna jump right into some more topic on behavioral health and mental health, okay? From
Mhm.
your perspective, once again, okay, what are the biggest mental health challenges people are facing today? What would you say?
Whew.
Yeah,
Wow.
let's take that's where I want to take it, and that's why you're here.
That
Can I have two people drop the lean in stickers, please? As she's preparing her answer, can I have two people drop the lean in stickers? As you're thinking, I'll repeat the question for you one more time, Dr. Francis. From your perspective, okay? What are the biggest mental health challenges people are facing today? It's a lot going on. Dr. Francis, it's a lot going on.
I know.
Let me break it down for you in our term. A bag of things are going on. Okay?
Yes.
Okay. So
Yes.
take us there real quick, please.
Um, and there's so many. If I'm thinking about my own clients, definitely the substances. I see
Okay.
that all day, every day. So
Okay.
I think that people are trying to find something to escape their reality.
Mm-hmm.
And more times than not, that's how it starts. Like, well, sometimes it's just a friend give it to them, but when it gets to the point of addiction, it's like, I just don't want to feel. I don't want to think about what's going on. And then my rebuttal is like, when it wears off, your problems are still there. And they're like, yeah, but for the 5, 6, however many hours that they are intoxicated, they don't have to think about those problems. And that matters more than anything else. Trying to escape reality in a way. So I would say the substance problem definitely correlates with the mental health problems,
Mm.
because the your mental state can impact you or influence you to use drugs and alcohol, or flip the drugs and alcohol in turn can definitely result in a mental health problem. And we're seeing that a lot with this what is it called, the laced drugs, like the weed. Like our Jamaican people love to smoke weed, if we're being honest. A lot of marijuana or cannabis has now been tested, and it's being laced, and a lot of people are going into psychosis when they're taking
Why?
these drugs. And But if I were to say that to my family, it's like, that's not true. That's BS. No matter how much research is on it, they don't believe it because preconceived notions. But it's true. There's a lot of people, kids, like young teenagers and early 20s, 30s, like their first psychotic break, and they don't understand what happened. And then when you test the drugs, it's like it was laced with fentanyl or
Why?
something like that. And then it's
Why?
hard to get off.
Right. Thank you so much for sharing that perspective. Dr. Selena in the chat also mentioned self-medicating.
Mm-hmm.
A lot of people do like to self-medicate, and sometimes that could also do more harm than good, depending on the situation. Everybody's situation is different. So let's continue. For those of you who are just joining on in, we are interviewing today's subject matter expert, Dr. Michelle Francis, Table for Two podcast. I see you. Welcome on in. Doctor of Behavioral Health and licensed clinical social worker. I want to continue on mental health. Dr. Francis, speaking of self-medicating, like what Dr. Selena said, I want to hear from you on this perspective. What are some early warning signs that someone may need professional mental health support? Think about it. People always like to, work their way through it,
Mm-hmm.
or they don't want to go sit down and talk to that lady or talk to that man on the couch,
Mm-hmm.
or they may be opposed to medication. What would you say are some warning signs that, hey, you need some professional help? Hey, what you've been doing, that self-medicating, has not been working.
Yeah.
Or hey, you've been trying to do all this other rah-rah that's not been working. You need some help. So what are some warning signs that you can share with us that somebody needs professional mental help?
So, one of the biggest ones is isolation. When
Mm,
somebody who you see or talk to all the time, colleague or client, depending on where you are, they start isolating. They're not picking up your phone calls or returning calls as much as they used to. There's a difference between being busy and being like isolating because you get to learn your family and friends and people's patterns.
right.
So if I were to call, let's say, my mom and I don't hear from her today, not the end of the world, but if I call her a few more times, throughout the weekend, I don't hear anything. I'm like, okay, something's definitely wrong here. Similar to a best friend. And so anybody who isolates, like even that person at work, if you usually have lunch with them, or if they're coming in a little bit later and they're saying, no, I'd rather eat alone, like certain patterns, they start switching up a little bit. So that's when you can start asking, like, is everything okay?
Hmm.
And if they're like, yes, more times than not, they're going to say yes. You just say, well, I'm here to support. So isolation is one. Another one is overly productivity. Like so that might sound like the opposite. Well, it is. Well, because sometimes when people are depressed or in a low mental state, they try to overcompensate by
Hmm.
working. And sometimes I will say I'm guilty of that, if I'm being
Me
honest.
too.
Like I
Me too.
I just work it, I work through it. Okay.
Me too.
That doesn't mean it's okay, but I relate to the clients in that manner. It's either I'm going to work or I'm going to be sad. And I don't want to be sad, so I'm just going to work.
Right.
So that's another sign of it. And that for high achievers, overachievers, that's something we have to be very mindful of because it
True.
can turn into like isolating yourself from everything at the same time. And that can impact your work at the end of the day. So you don't want that to happen either.
Right. Right. Exactly. Mac, the therapist in the chat, said the over functioning. Exactly. On Dr. Mimi, I see you in the chat. Welcome on in. Trisha M, I see you in the chat. Welcome on in. We're gonna continue. Um, this is one of my favorite topics. But how important is cultural competent care within mental health or just behavioral health overall? How important is it? Cultural competency.
Oh, very. Oh my
Hmm.
gosh.
Hmm.
I don't think you have to know everybody's culture. So I think
Right.
that's where cultural competency gets a little clouded when people are like, I need to know everything about my client. No, that's not the case. But you need to be understanding and be willing to learn.
Right.
So if I have people who are not black and not Jamaican, obviously. So I tried to learn their culture. Like, oh, what does
Hmm.
that mean? Like I ask questions in session because if I don't ask them, I won't know. And I like to say I just love to learn. So I'm gonna ask. So
Right.
cultural competency is super, super important. If you don't feel competent in that area though, and you've been seeing this person for a while, it's okay to refer out And I think that's something that a lot of clinicians are scared of, especially new clinicians. Feel like you can't refer out because you feel like a failure or something. But no, it's better for you to send this client along to someone else who may be a better fit than for you to feel like you have to see everybody who come your way.
Makes sense. Makes sense. That's a good segue to my next question. What advice would you give someone who is hesitant to seeking therapy for the first time? You know, they're looking at it like, I don't want to go sit down and tell everybody my
Yeah,
business. I don't want to go sit down and have this person judge me based off my past or based off what I'm going
absolutely.
through. Once again, what advice would you give someone who is hesitant on seeking therapy for the first time?
I would tell them that I get it. I'm like, look at my culture. I'm a therapist. I'm a doctor. I'm a therapist, and my family still look at me like I'm crazy when I tell them
Okay.
that I'm a therapist. So
Okay.
that just means like a lot of people still don't necessarily think it work or believe in it, and that's okay. But I will just say I understand, and I'll tell them all of the ways that therapy can benefit them, and the fact that I can come from a culture that don't necessarily, if we're being honest right now, still support therapy. That's a good way for me to tell them like I grew up in it. I see how I could have benefited from a therapist as a teenager, but that wasn't available to me. Um, so, as hard as you feel like it is to open up to someone, just give it a try. One of my favorite things to tell my clients, because I do work with substance abuse individuals, they're like, oh, I don't want to try it because I didn't get along with her. So I always say, like, when you try drugs, just because when you get a bad batch, you didn't stop using. So you can't really base that as the reason why you don't want to see a different provider. You're not going to get along with everybody you work with. Just like
True.
if I don't get along with my primary care physician, I'm going to get a different one. But I would say definitely give yourself the permission to heal. That's probably what it is. People are they think that other people are judging or how they're going to be perceived if they do go to therapy. But at the end of the day, you have to take care of yourself and you
You
only.
do.
And the people
You
that
do.
you're worried about, they are not thinking about you in that manner.
True. True. Thank you so much for sharing that and being transparent. That's why you're here. Can I have two people drop their subject matter expert stickers in the chat for Dr. Michelle Francis before we continue? Two people drop their subject matter expert stickers in the chat before Dr. Michelle Francis continues. Miss Nike, I see you. Thank you so much. I need one more person. Just at least one more person. I need the subject matter expert sticker in the chat before Dr. Michelle Francis continues. Are we gonna wait? Matt, the therapist, I see you. Thank you so much. Dr. Francis, I want to get into an important topic that I'm sure means dear to you, both you and I, and the other people of color here. And you know what? Also, what I've realized, the majority of my people are people of color. Okay, and that can be black, brown, Hispanic, people of color. You know, stigmas. I want to talk about
Hmm.
that. Okay,
Hmm.
why do you think mental health stigma remains especially strong within the black communities, the brown communities, the Caribbean communities, the Hispanic communities? Why? Why do they just want to give us a cup of tea? Why? Mint tea. You know what somebody told me once before you continue, I want to give you this joke. When I was going through something, because Dr. Johnson was going through something at one point, this family member came to me into my room, looked at me, and said, "You need a bath. You need a cleanse." And we're not talking about a shower bath. You need a bath. You need a cleanse. Something is over you. You need a cleanse.
Hmm.
What if that cleanse was just a medication and going to go see a therapist?
Right. They don't want to hear that though.
I'll repeat the question for you one more time. Why do you think mental health stigma remains especially strong in black and brown communities, including Caribbeans, including Hispanics?
I think it comes down to people being embarrassed, if I'm
Mm,
being honest.
hmm.
Embarrassed that they're going through something, whether for the guys, they're machismo, they should
Hmm.
be able to handle whatever is happening in their life. And then for the women, taught to be strong, you're the matriarch. Like anything is wrong. Well, that's how it was traditionally. Anything is wrong. You just talk to your girlfriends about it. You gossiped. But you don't need to go see somebody you don't know and put them in your
True.
business. So
Mm,
that's one. I think it's shame and embarrassment. And another one, I think it's the religious fixation that a lot of our Caribbean brothers and sisters and our Hispanic and other non-white people, a lot of us grew up or around church. So that's something that people were either talked out of, like you just prayed away, talk to God or talk to the pastor, and so on, as opposed to saying I need additional support. And that's where the shame comes in again, because they're saying talk to pastor, but you're like, I need more than that, and they're like, no, you can't tell people what's going on. Fun fact, by the way, there is a lawsuit right now against a church where this teenager, I believe he is or was, went and said he needed some help. And they're like, just talk to the pastor. You don't need a therapist. And the person ended up dying by
Wait.
suicide. So now,
F1, 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 F1 in
oh,
the
I'm
chat.
sorry.
Yeah, you continue.
Yeah.
You fresh, you new.
Yeah.
Don't worry about it. Continue.
Yeah, they unalived themselves. So yeah, now the family's gonna sue the institution. So
Wow.
that will be interesting to see what plays out there. But I do think shame and also the religion is why.
Right. Thank you so much for sharing that. Okay, and y'all, just you see, some of the folks I bring up on here, they're not a TikToker. Okay, I've been on here for about a year now. I'm still learning the ins and outs of it. Okay, so
Okay.
shout out to Dr. Michelle Francis for even agreeing. This is your first time going live.
Mm-hmm.
I appreciate you. So can we have a two round of applause in the chat for Dr. Michelle Francis? Two round of applause in the chat for Dr. Michelle Francis. The first time she went live, she came live in Dr. Johnson's office hours. I appreciate you. Um, Dr. Michelle, how can families better support emotional wellness? What conversations should be had or can be had to better support emotional wellness? And I'm talking about the Black and brown families. Because, the other side, they be sending their people to therapy.
Yeah.
Their therapists be on speed dial.
Mm-hmm.
We don't. The only thing on speed dial for us is not even 911 if I'm keeping it a buck, because we're not gonna call them folks neither. So we don't really have nothing on speed dial. Y'all laughing at me in the chat. TikTok to shop is amazing. Dr. Michelle, what conversations should Black and brown families be having in their home to better support emotional well-being?
Well, the first thing I was gonna say, but Crystal said it, is not telling other family members about what is going on with this person, because sometimes the problem is we may want to open up to someone in our family, but you know that your mom is going to call her sister is going to tell her kids is going to tell the cousin. So I think that's one of the biggest things, not being able to know who to trust within the family unit. So that automatically lets the support is not in the home at that point, unfortunately. But if it was, it would be for, let's say, me to reach out to my mom and tell my mom, like, I'm having a really hard time right now and I really need some support. And in that moment, you may not know what you need. It's just admitting that you need help is big enough. And then hopefully that person that you can go to can help you look at other things to look at. Maybe it's to go to the doctor, because it should start there. Like, let's rule out medical and then go from there.
Right. Thank you for sharing that, Dr. Michelle. So we mentioned faith, and a lot of us in here in the chat, we are Black, we are Caribbean, we are Hispanic in the chat. So we can kind of relate to this. But how can faith communities, schools, and local organizations, employers help reduce the mental health stigma overall? Let's look at the big picture, okay?
Mm-hmm.
What would be your recommendations, or what would you say? Dr. Selena, I see you in the chat. Thank you so much for sharing out the live. Thank you so much for following. I see you. I'm definitely gonna send you a message. Miss Luna, I see you like in the live. Her Divine Alchemy, I see you like in the live. I appreciate you guys all being here for this important conversation on mental health as we wrap up the month of Mental Health Awareness Month. You want me to repeat the question?
Yes,
You good, friend?
please.
Okay, I'll repeat the question. Hold on. Where am I? How can communities, schools, local organizations, employers help break the mental health stigmas?
I think one way, very important way, is bringing in mental health professionals into these spaces.
Okay.
Like some workplaces already do it. They have trainings on, cultural competence and mental health as a whole. So I will say some workplaces, the bigger companies, are trying their best with that. Same with schools. I think with schools, it doesn't necessarily have to say like, because elementary school, at least, like career day. having mental health professionals go like, hey, I'm a licensed clinical social worker, I'm a licensed mental health counselor, like what do I do, um, along with all of the other important like fire person and other job occupations that go to career day. So I think career day would be helpful. In the religious spectrum, same thing, like
Mm-hmm.
yes, you have your pastors, but one day it could be a special guest as one of us to say, hey, like you can even have a Christian therapist, because that's a whole nother line of
Right.
their counseling, that people feel more secure with somebody who shares the same faith as them. So that's totally
Right.
fine. So I think just showing that us as the providers are willing to collaborate, because we are more than anything, we love to collaborate with other people. It's just, are they willing to collaborate with us so that the people they serve can see that we are here to help as well.
Exactly, exactly. Thank you so much for sharing that. For those of you who are just joining on in once again, today we're interviewing subject matter expert, Dr. Michelle Francis, Doctor of Behavioral Health and licensed clinical social worker. I want to get into substance abuse. I don't know if I can say that word on here, but substance abuse, okay? I also want to acknowledge in the chat, Miss Crystal said the therapist might be the boat that God sent to save you. Exactly. So people are always quick to hoot and holler about, oh, let me pray it away, let me pray it away. What if you can find a faith-based therapist? Hello? You
Right.
can. Mac, the therapist, said change the stigma of the profession as well for social workers. That's a great start. Exactly. They also saying to normalize mental wellness. Exactly. I see you guys reposting live. I appreciate you. Thumbs up or praying hands is me acknowledging you guys in the chat. Okay, Miss Mackie, I see you. Um, Dr. Francis, how closely connected is mental health and substance abuse disorders? What would you say?
10 out of 10.
Mm,
Because most
mm,
people who are diagnosed with substance use, they
hmm,
have dual diagnoses for mental
mm.
health disorders. So
Okay.
I cannot say if I wouldn't even think it's accurate for me to say anyone I see with substance use concerns don't have a mental health problem. I no, I think they go hand in hand.
I want to acknowledge something in the chat too. Ms. Luna said BetterHelp, that's a platform that provides therapy. BetterHelp offers faith-based therapists as an option. Same thing for Grow Therapy. I use Grow Therapy, and you have the option to choose down to all your you know how you can your edits, you could choose if you want a man, a woman, a person of
Mhm.
color, faith-based, like all the different that you want to cover, you can choose that. So don't think that just because right when you go seek therapy, it's just one plan. No, you can edit that. You can edit your, you know, you can edit like your MySpace page. You could edit your therapy. Why did I just say MySpace? I just showed how old I was. You could, just like how we edit your Instagram and your TikTok page, you can edit how you want to receive your therapy. Okay. Ms. Crystal said, and even if they aren't faith based, we are taught to acknowledge religion and spirituality when it's a client's value. Cultural competency is important. Hello. Exactly. Thank you for sharing that, Ms. Crystal. Um, Substance abuse. How do you approach treatment without judgment or shame? You know, that's big. How does Dr. Francis thoroughly, professionally provide treatment in a non biased way? No judgment. Dr. Michelle Francis, let's just give it let's give a scenario because you know in healthcare administration they always be giving us scenarios and they always put us through simulations. Dr. Michelle, you guys F1 in the chat prior to before what I'm about to say. Dr. Michelle Francis, I did crack for the second time and I like it, but I want to get off of it. Help.
Okay.
Crack cocaine. And you guys obviously we all know there's no judgment in here. This
Yeah.
is educational purposes. We're just doing a quick scenario, a quick simulation. Dr. Michelle Francis, this is the second time I've done crack. I don't want to be on it no more, but it make me feel good. Can you help me?
Absolutely.
Okay. And
Yes.
how patients like that, how are you able to help them in a non-biased way?
Well, I approach all clients non-biased because I look at it as with substance use, everybody is affected, whether it's super low income to the person in the biggest mansion. So
Hmm.
I've always had that mindset that it doesn't matter. Substances impact everybody in similar manners. So I would just say, okay, it's the fact that you're asking for help shows that's a big first step. So let's talk about it. First, I want to find out, how did you get the drugs, or the crack, and they'll let me know.
Hmm.
The reason I'm asking that question, I want to assess if they are, if they go back to that environment, will it be a problem? Will it be a trigger
Mm.
for them?
Mm-hmm.
So if they're like, somebody in my home, well, we got to find an alternative. Where else can you go? Or I got it from a friend. Okay, you can't hang out with that person no more for a while. And
Right.
in terms of what this, if they want treatment for crack cocaine, maybe won't be necessary to go to a residential facility, but I would highly suggest that they go to Alcoholics Anonymous or Narcotics Anonymous, just a way to gain that community for individuals who have probably been at rock bottom. This person is not at rock bottom. This person is noticing that this could lead to rock bottom if they continue. So it's good to see people where you don't want to end up in order to try to stay on the right path. And also just
Mm-hmm.
checking in, like we'll create some goals and go from there.
Mm-hmm. I love that. I love that. I want to piggyback off of creating some goals. Okay. What does successful recovery look like beyond sobriety? Miss Kina, I see you. Welcome on in. Miss Crystal, thank you for the heart me. I see you. Once again, what does successful recovery look like beyond sobriety? So once I'm your client and I come into you,
Mhm.
you've helped me, you've treated me, I'm no longer on said drugs. What does sobriety look like after?
Well,
What does success look like? You know?
that will be person by person to decide what
Mm,
success looks like. So
okay.
for example, someone that I have right now, success for them is their family talking to them after
Mm,
this because they burned so many bridges. So having their family talk to them. Success for another person is being able to have visitations with their child because they haven't been able to
wow.
see them. Another
Right.
person, success is just being able to get their license back. So they're able throughout that early recovery period, they're able to pay off their fines and because they're not using their money for what they used to before, now they're able to catch up on certain debt that they had. So success will vary for everybody, but the goal is to remain sober per se because that's what's leading you to accomplish everything else that you've been doing.
Makes sense. Makes sense. Thank you so much for that breakdown. I want to tap into now your you do have many hats, just like a true Jamaican, okay? I want to tap into your licensed clinical social worker hat, okay?
Okay.
Social determinants. You know, we love that topic. Okay. And that healthcare administration, public health, social work, we combat. Okay. Do social determinants like housing, education affect or can affect someone's health? I see you, Miss Crystal.
uh it's number one. It's the
Mm,
number one reason why so many people either thrive or necessary um, shelter, clothing, and stuff. It's easier for you to have a start than somebody who's unhoused right
okay.
now. And we have so many people who are unhoused all over. I'll just speak for Central Florida because I lived in Broward County and I know that library downtown, how that is with
I
the.
know I know exactly what you're talking about. I know
Yes.
exactly what you're talking about. I for you so you really down wow, you really local
Yeah, I'm
for
from
me.
Fort Lauderdale.
Okay. Okay. I'm in Dade County. I'm more south.
Oh, okay. Okay, so you're
Okay.
Miami.
Yeah.
So
Okay.
so yeah, I forgot the question. My bad. We gotta go.
Social determinants. Alma's welcome on in, Habisha. I see you. Today we're interviewing subject matter expert, doctor of behavioral health and licensed clinical social worker. May is mental health awareness month, so we are wrapping up my last interview for the month of May. Everything mental health, everything behavioral health, and everything overall well-being. Dr. Francis, social determinants like housing, employment, and education, the effects that it has on mental health. And also, y'all see the professional that I have in the chat? She said the correct terminology, the unhoused. That's no, I have to big you up, friend. I gotta big you up. That's one thing that it's important to be politically correct. And if we're talking about cultural competent and if we're talking about, being non-biased, we do not know that certain words or certain things that we may say can be offensive to certain people. Okay,
Hmm.
my friend said the unhoused. Shout out to you. Continue. I'm sorry. I'm sorry.
Yeah. So the social determinants of health, those are primal. In order for just the basics for what we need, like a high school education. That's like the basic right now. Then to get a job and then your own housing. And so without all of those things, it's just gonna be harder. And
Mm,
even people who have those things have mental health concerns much less individuals who don't. So I do think that if any of those are missing, it does increase the probability of developing some type of mental health concern. Because if you don't have a job, the anxiety is through the roof about how am I going to provide for myself, and then that could lead to depression, and
Right.
that leads to not being able to live somewhere. So it's just all of it connects. And if you don't have the education, that same thing, because after a while, you're kind of going to be out. People are going to have more of a chance to get those jobs than you are. And then it leads to the same I'm not worthy, all of these self esteem problems. And then mental health is impacted. And the
Right.
cycle continues.
Makes sense. Makes sense. And Miss Kristen in the chat, she said hierarchy of needs.
Yes.
Exactly. For those of you just joined, Lily, I see you. Welcome on in. Vibe Wellness Women, I see you. Welcome on in. Once again, we are interviewing subject matter expert Dr. Michelle Francis, Doctor of Behavioral Health and licensed clinical social worker. Right now, I'm having her tap into her social work hat. Okay, because Dr. Francis does wear many hats. Okay, so right now we are on the social services aspect of everything that Dr. Michelle Francis does. Let me ask you something. Healthcare is ever changing. It is ever evolving. Policies are always changing. Okay. And us as healthcare professionals, we have to stay abreast. Okay. So I say all that to say, how can social workers advocate more effectively for the systemic change that's inevitable? What would you say?
We just have to keep showing up.
Mm,
That's like number one, like going to we have this thing lead day. I don't know if other professions have it. But
hmm.
social worker have lead day in Tallahassee where you go and advocate for bills to be passed and stuff like that. So I say just continue to show up, speak out when we see these things, all areas of social work. Medical social work is a big topic in terms of always trying to get the patient out as opposed to save a bed day, as opposed to taking care of the needs to reduce readmission. So as social workers, and it's super important. I think this is the most important. I feel like a lot of
Hmm.
times when you do um, micro social work, that face to face with the clients, you don't lose touch. You see what's
Right.
going on. I think the issue becomes when people go into policy and administration, where they kind of lose touch of the real human
Hmm.
connection, and they're more focused on numbers. And I get it from the organization standpoint, that's what they have to do. But there needs to be
Hmm.
more of a balance for individuals who are in leadership to see that we are not just saying these things just for fun. Like, people actually need help. And that's what's missing.
Right. Right. Thank you for so much for sharing that. Breaking the stigma. Okay. Let's briefly talk about breaking the stigma because it's important. I'm not going to invite this um, black educated healthcare professional, and we're not going to talk about breaking the stigma and just public awareness overall on the topic. Okay. Dr. Selena said, keep evidence based practice. You have to. You have to. It's a must. Um, Dr. Francis, what are the most harmful stereotypes right now surrounding mental illness from your perspective? Remember, there's no right or wrong answer. You're here because I want to hear from your perspective and I want you to share your perspective with my people. Once again, what are the most harmful stereotypes surrounding mental illness right now?
One of them, I would say, if people can't see it, it doesn't
Hmm.
exist. And a lot of times with mental health, more times than not, you can't see it. Like, when I
Hmm.
say see it, I mean if your symptoms are not obvious. You're not going
Okay.
through psychosis. Psychosis is, you'll know what that is if somebody's
Hmm.
hallucinating and stuff like that. But let's say I'm depressed and I'm high functioning, as I mentioned
Hmm.
earlier, I'm getting everything done at a million miles per minute, and the that's a stigma saying, well, no, she's not how can she be depressed and still do everything? Like, there's nothing wrong with her. But that is the stigma because I don't have anybody to lean on. I can't call, like the example earlier, my mom, because she's going to call my aunt and call whoever. So there's nobody to really talk to about what you're going through. Thankfully, I am amongst other clinicians, so it's a little easier. But for the person who's not, who don't have a clinical circle around them, the stigma will continue. And if somebody can't really tell that something is wrong, then they're gonna say you're lying, or you're looking.
Right.
Some people might say you're looking for attention, and that's not the case at all.
Right. Right. I love how you keep saying that you can't call your mama because everybody gonna know. Sister Pat's wait no, wait, no, wait. Let me take it there real quick. Let me let my chat feel like how we would feel. Sister Patsy gonna know your business. Auntie Mildred, Uncle Wilburn, the gate man down at the church.
Mhm.
You're an elementary school teacher, but now you're 30 odd years old. But how your elementary school teacher know that you're having some mental health
Exactly.
issues? Oi,
Exactly.
let's continue, okay? And that's a good segue to my next thing. Why is vulnerability often viewed negatively in some communities? Why can't I just show up and say, I'm not feeling my best? I feel
Right.
weak. Why? Mac the therapist said the mailman, the lunch lady who goes to the church with your
Mm-hmm.
grandma. Why? What
Right.
the yard man? How the yard man know that you're having issues and he's pulling you aside? Just pray, okay? I'm sorry. I'll repeat the question for you one more time. Why is vulnerability often viewed negatively in some communities? Why can't I just show up and say I'm weak? I need help. I don't want to always be strong.
Because that's how we're socialized in those
Mm,
communities, to be strong, to be the person that nobody sees crying. And that goes for everybody, male, female, other. So it goes for everyone. So that's how you're socialized. That's how you're raised. Don't cry. Don't do this. So it's hard to be vulnerable. But I think it's actually the opposite. I think vulnerability is like the greatest strength you can have. So to put your pretty much like wearing your heart on your sleeves, like saying how you feel, it is so hard. It's harder to say that than to say I'm fine. To actually
right,
say I am not okay. I need help. That is so hard. So it's hard to be vulnerable because people are not going to be receptive of what you're going through. So it's easier to put on a facade and act like everything is okay, so you don't have to talk about
right. Right, Dr. Michelle Francis, you're doing such an amazing job. Shout out to you, and I just appreciate you just being so vulnerable and also being so transparent and just agreeing to this. I appreciate you so much. I want to get into your clinical practice. I'm sure you know, but I'm big on people running down the resume. Miss Crystal in the chat was saying that she was telling you to run down the resume. I'm big on that. Okay, so not only are you a doctor of behavioral health, not only are you a licensed clinical social worker, you are also a big boss and big CEO of your own clinical practice. Okay.
it.
And
Yeah.
people always ask how you know he's Jamaican? Just look how he is. You know we are gonna big up everything
Right.
because if not, who else? But you know what? I'm learning. I've just started to learn that because I never used to like to because I don't like to be. You know we don't. They're always teachers don't be too bossy and don't
Yes.
you're too
Yes.
show offy and you're too.
Yes.
So that's ingrained in me, you know. But now, as I've gotten older and as I'm, mixing and mingling with other people, you need to big yourself up. You need to run down your resume. So and my chat always reminds me of that. So whenever I bring my interview guests on up, I make sure we go down your resume. Let's get into your clinical practice before we wrap it up.
Okay.
What inspired you to start your own clinical practice? Why? What was the why behind that?
Honestly, I wanted a therapist when I was a child, and I didn't have that. So I was like,
Repeat. I'm sorry. I want to cut you off. Repeat that one more time. Before we continue, Dr. Selena said you have to brag on yourself because no one else will do it, especially if you okay. Okay. Dr. Michelle, I want you to repeat that. You started your clinical practice. Why?
because I wanted a therapist as well when I was younger. I feel
Mm-hmm.
like it would have benefited me a lot, but I didn't
Mm-hmm.
have that option. So yeah, I wanted to be that therapist that I could relate to, because I feel like I'm relatable. So when I meet these people, and it's almost like talking to a friend. Obviously they're not my friends, but it's so
Right.
easy going the way the conversation is that it works out. So honestly, just wanting to build something that I felt like I would have benefited from, I think that
Mm-hmm.
helped drive me and continue to drive me to continue to do what I do with my practice.
I love that. Thank you so much. Hold on. TikTok is making me do the puzzle. There's probably I want to understand why they make us do the puzzle as if my chat is going. Miss Tanya, I see you. Welcome on in. The key, I see you. Welcome on in. Today we're interviewing subject matter expert, Dr. Michelle Francis, Doctor of Behavioral Health and licensed clinical social worker. Um, I want to continue on the clinical practice, okay? What were some of your biggest challenges? What were some of your biggest challenges opening this practice? Now, keep in mind, for those of you who are in the chat who are not on the clinical side or who don't have your own, don't want to open your own clinical practice, um, take her response generally and you apply it to how you see fit. Okay, she's a business owner. Okay, Dr. Michelle, what were some of your biggest challenges opening your own business? Let me word it like that.
Yeah. Being a one woman show, if I'm
Okay,
being honest, that is the
okay,
hardest part and continues to be the hardest part. Because
mm,
I know what I'm looking for, and I can do that because I know what I want. And I'm the one providing the service. So it's one thing when my the type of job that I do with therapy, I have to be the face of the business. So I can't just sit back. I got to be forefront. So I'm the one taking care of the consults, the scheduling, everything, every little thing. And you're like, well, babe, you could just hire someone. In the future, that's the goal. But right
right.
now, that's not what it is. So just being the face of the brand, like trying to and also figuring things out, like because you when you don't really have someone to lean on in that aspect, like you're learning as you go, which I'm
Hmm.
thankful for because I'm like it's a slow and steady rise as opposed to like, oh my God, a million referrals. That would be crazy because I wouldn't know how to keep up with it versus
Right.
like it's steady. Um, so I would say that, and I want to touch on what you were just talking about
Hmm.
celebrating yourself. I have the
Hmm.
hardest time doing that. Like the hardest time. And even with the doctorate. I'm finally comfortable now with my clients calling me Dr. Michelle or Dr. Francis, but I don't introduce that myself as that when I go out in public. And I'm like,
I don't
do I
either.
need to?
I don't. Listen, I don't either. Let me tell you something. I went to a career fair. Okay, one of my alma mater. Oh, you know it, Nova. You know Nova.
Mhm.
They were hosting a career fair, and I brought one of my sisters along with me, and she was just looking for a role too, something else, to do part time. I'm there meeting the people, and I did not say doctor not one time. And she looked at me and she said, "This is Doctor Johnson, and he's interested in this." And I don't know why he's not saying that he is Doctor. You see what I just did?
Mhm.
She's doing this in front of the future, in front of the people, the employers,
Mhm.
and I'm here like, oh, just chill, just chill. So I know exactly what you mean. But guess what? We have to lean into it.
Yeah.
And so a couple people on here who I've met too, they've told me, people will see when it's coming from a place that you're being genuine. People will see that it's not you trying to be, oh, I got this degree and I'm better than you.
Yeah.
We're not being classist. We were raised that it was very classist, and but we're not being that way. So I think
Yeah.
that's why it's so hard. You're gonna have to work. We're gonna talk on the back end. We're
Yeah.
gonna have to work. We're gonna have to work
We got
together
to work on it
because,
together.
yeah, yeah. Dr. Michelle Francis, you are Doctor of Behavioral Health and you are licensed clinical social worker. And I also saw the I too. So that means you're a licensed independent clinical social worker too. Come on. Okay. And you also have that QS at the end. That QS means qualifying supervisor. Come on. Did you
Mhm.
guys see how I just ran down her credentials? And she don't want to put that doctor in front of her name. Now, here's the thing. You see when it's not a professional space, oh, call me Anthony. Oh, please, just chill. Bro, just chill. But with my students and with the other professors, when I'm on my campuses, it's big, Dr. Johnson.
Yeah.
And I remember when I first got my first professor job, my department chair said, "I know you're young, and some of your patients, I mean, some of your students will be, twice your age. Make sure they call you doctor." She had to pull me aside and reassure that to me, you not they friends.
Yeah.
So once again, like you said, you not they friends. You may approach it in a friendly, relatable way, but then
Yeah.
you have to make sure they say Dr. Michelle Francis. Okay.
Facts.
Dr. Selena said put some drink on it. Miss Crystal said not the little one.
The biggest.
Okay, the biggest one. Okay. Before we wrap up, I always ask two questions to wrap up my interviews. What we're talking about mental health. Okay, mental health this and mental health that. What does Dr. Michelle Francis do to stay on top of her mental health, and how do you navigate burnout? Okay, because you guys, I went down her credentials. I'm not going to do it again. She does wear multiple hats. Dr. Lola, work all the doctors rolling on in today. I love tonight. I appreciate you guys all being here. Dr. Michelle Francis, how do you navigate burnout? Because I know you got it. Let's be transparent. I got it too. How do you navigate burnout and how do you stay on top of your mental health?
So the mental health one first. I see my
Mm-hmm.
own therapist. So that's how I stay on top of my mental health. I have somebody to talk to. That he knows I'm a therapist. I was trying to hide it, but he figured it out.
Pause for a minute. Why do y'all do that? I have aunties. I have so many people who are nurses. Whenever they go into a doctor's office or the hospital, don't tell them I'm a nurse. Don't tell them I'm a doctor. Why do y'all do that?
I can speak for myself. I can't speak for the nurses.
Mm-hmm.
I will say because I didn't want him to feel like he I wanted him to be authentic. I didn't want him to feel like he was performing or needed to
Okay.
do more than he needed to or say, "Oh, you know about this already." I don't want that. And he doesn't do that, thank God. But I just wanted somebody just very regular. So yeah, I see a therapist for my mental health, and I also have family and friends that I talk to. And that's also how I prevent burnout. Is I decompress. Like when I'm not working, I don't think about work. And I think that's a really good habit that I've developed because I used to work in, speaking of the resume, child welfare. I used to work for
Mm-hmm.
DCF, and
Mm-hmm.
you didn't have that's you have no time for yourself when you work in that job. So after that, I was like, I need to commit to not mixing my personal life but my professional life. So when I'm off the clock, I don't think about work, and that really
Mm-hmm.
helps me.
That's good. That's good. Thank you so much for sharing that and being so transparent. Last question, Dr. Michelle Francis. What is your overall why as it relates to the work that you do, as it relates to the reason why you continue to show up? What is Dr. Michelle Francis' overall why?
My why is to hopefully have a future daughter and show her
Mm-hmm.
that I did all of this before you even came on earth and you could do way
Mm-hmm.
more than me. So my why is really for like the future generations, if I'm being quite honest, to like keep pushing, keep going, because you can do it. And with all the changes that's coming, there may be more obstacles, but absolutely can get it done. So I just keep going for myself too, the little girl in me who wanted a therapist that I didn't have one.
Mm-hmm. Mm-hmm. Thank you so much for sharing. Dr. Lolo in the chat said therapy is key. 5 months with the same therapist. So grateful to have found her. And y'all, let me just share a win with y'all too. I recently graduated out of therapy too. When everybody knows what that means when you graduate out of therapy and they're like, you're good. To the point where one of my recent sessions, we were talking about jobs for her, and at one point I was sharing her a contact for her to go, like do some contract work. Where, Dr. Johnson, you good? Just hit me up when you need me again. She was
Yeah,
able to help me work through what I worked through, and I graduated out of therapy. And now it's just on an as needed basis.
yeah.
So I'm sharing that not to brag and boast. I'm sharing that to anybody in the chat. You can get there too. There is an end of the tunnel, and there's a pot
Hmm.
of gold. And that pot of gold is, hey, I'm going through this, but now I have the tools, I have the resources, I have the brain power to work my way through this. I know how. That's what that pot of gold looks like. Yeah, I'm not going to take it there, but Dr. Michelle, thank you so much for taking the time to step into office hours with Dr. Johnson. I appreciate all the work that you do. I appreciate you continuing to show up. Can we give a round of applause? And Dr. Lolo, I see you. I appreciate you too. Dr. Lolo, I briefly caught your interview the other day too. I'm definitely going to message you. I want to bring you over in office hours with Dr. Johnson. I'll definitely message you. Thank you so much for stopping by. But Dr. Michelle Francis, continue to show up, continue to be great. You're doing great work in the community. I want to see you more on TikTok. I want to start seeing you do lives. So before I let you go, what are your TikTok plans? How are you going to continue to grow? How are you going to build your own community?
Okay, so I plan to post. I've been posting a little bit more. I'm not a
Okay.
poster, so it's like super weird. So I'm trying to
Hmm.
post a little bit more. I do plan to go live eventually. I just need to figure out what I'm going to talk about to
Okay.
just go show up and see what happens.
Okay. And I do hear that a lot too. You see, with our field of work, there's so much that we can talk about. Okay. And your page is tailored for you being the healthcare professional. Talk about behavioral health, talk about signs and symptoms, talk about social work, you know, talk about you owning your own business, your own clinical practice, so many different things that you can talk about.
Yeah.
Okay. One more thing before I let you go. TikTok is they very friendly here. Okay, I've been when you are genuine, when you are consistent, and when you show up, and when you are When you are being a resource for people, they will gravitate towards you. It's not like Instagram. It's not like Facebook.
Yes.
Well, we face is not like Instagram. Is not. I've been on Instagram for years, and the support that I've gotten on TikTok, it doesn't even compare.
Yeah.
So do not be fearful. Like what Dr. Celine just said, just go live.
Okay.
Okay. Once again, I appreciate you. Thank you so much for stopping by. I'm gonna holler at you because you know I do monthly panels. And each
Okay.
panel, yeah, each panel is each month is a different topic. So if you fit one of those topics, I'll definitely reach out to you. Okay, Miss Crystal in the chat said this community is mighty and loving. It definitely is.
Awesome.
It
Thank you
definitely
guys.
is.
I appreciate it. Follow me and I'll follow you guys back. I really appreciate you for having me, Dr. Johnston. And we finally made the time because last time wasn't
Right,
available.
right, no problem. So once again, thank you so much. I appreciate you. I'm gonna drop you down. Okay,
Okay. Sounds good.
continue to show up and continue to be great. Okay,
All right. Thank you.
that was amazing. Yeah, okay. I see how you correct yourself right there, Miss Crystal. I see you. I see you. I appreciate you guys. I appreciate you guys very much. I'm hungry. You guys know what. You see, once my interview gets dropped down, once we hit that 8 o'clock, 8:15 mark, your boy be getting hungry. But before I get hungry, we're gonna get into Professor Tips for the new folks here. The first part of my each of my office hours, it's three segments. We do a trending topic in healthcare. We do an interview guest for segment two, and then segment three is Professor Tips. As of recent, for my Professor Tips, I've just been sharing some jobs, some employers, and some jobs that I just want to share with you guys. Okay, I see one of my moderators. Can we go ahead and pin that? The first Professor Tip is 24/7 talent. Now, once again. Yes, I am in healthcare. Yes, I am in healthcare administration. But some of these jobs I want, there will be for some folks who are not really in healthcare. And that's what that first one is. So 24/7 talents. And you guys know we big on remote work, okay? If you want that supplemental income, find your little remote job. I found one here. At 24/7 talent, they are looking for a benefits and people's consultant part-time. 35 to $45 an hour. This not your main job. This can be some little side hustle, little side money, little part-time job. Okay. It's a growing consumer brand. They are seeking a detail-oriented benefits and people's consultant on a freelance basis to support key people operations and benefits administration functions for the company 24/7 talent. The role is benefits and people consultant. It is part-time, 35 to $45 an hour, fully remote. Okay, fully remote. Let's go on to Professor Tip number two. Which one you guys want to drop? Professor Tip number two. Which one you guys want? Okay, we want to do Cedar Sinai. Perfect. Cedar Sinai, they are currently looking for a staff scheduler. This was actually one of my first jobs I had when I was in school. Miss L, I see you. Thank you so much. I appreciate you. Cedars Sinai, we spelled it right? Yeah, Cedar Sinai, they are looking for a staff scheduler. The staff scheduler is responsible for organizing and coordinating day-to-day staffing schedules for providers and support staff in an outpatient setting. It's fully remote. Do this on the side. It's fully remote. Schedule them, people. It's fully remote. Professor tip number three. Professor tip number three is Petco. You like pets? I got a job for you. Professor tip number three is Petco. You like pets? I got a job for you. That's a commercial. Perfect. I see you. Let's pin that. Perfect. Petco is hiring a senior analyst for their health and welfare programs. Pay is not listed, so list the pay. The senior benefits analyst plays a critical role in the strategic administration and oversight of Petco's retirement programs and the operational success of the health and welfare plans. This role acts as a primary liaison for benefit vendors, ensuring high level service delivery, plan compliance, and seamless execution of health and welfare initiatives. Posh History Professor, I see you. Welcome on in. We were just wrapping up my office hours. We just wrapping up Professor Tips. In my Professor Tips today, I shared three roles. One of them was at Petco. They're hiring for a health and senior analyst for the health and welfare programs. The other one that I shared was Cedar Sinai. They're hiring for a staff scheduler for their outpatient clinical department. And the third one I shared was a benefits and people's consultant part time. They are for 24/7 talent. These are all remote roles. Y'all go find you a job. Let's go find us a job, okay? Hold on, let me take off my headphones. Can y'all still hear me? We're gonna close out because we gonna wrap this up real quick. Let's wrap this up real quick with my what?
Yo, big up the doctor in the place. Professor Johnson, hold it down. Yo, 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 yo. Here big up the doctor in the place. Here the ready when the doctor come through.
Oh, can we get to 80K?
And
He
you know
said
what
stop
to
me.
do. Professor,
I said stop. I know. Yeah, I said it. I said it, but guess what? I said it. You know, gracefully and no disrespect. I know it's hard. Posturation professor, you know it's hard out here. They ain't hiring these folks. They ain't hiring these folks. Dr. Selena, I can send you her page after I come up off of here. I can send you her page. After I end the live, I'll send you her page so you can have access all of her resources. But yes, y'all find these jobs. We gotta find these jobs. Miss Nini Legacy, welcome on in. We just wrapping up office hours with Dr. Johnson. Dr. Selena, I'm gonna send you a message. Thank you so much for stopping by. Thank you so much for being here. We're gonna connect. We're gonna talk. I would love to I also like to keep my guests a surprise. So when I see you guys come into the chat, I don't like to say too much in front of everybody while we're in public. So I like to hit you guys up on the back end and we, discuss and see if we can connect and collaborate. Oh, 80K. Oh, we good. We out. Deuces in the chat. Can I get some deuces before I go? E Rose, I see you. No problem, Dr. Selena. I'm going to message you. Aaron, I'm going to make the voice sticker. Thank you for the reminder. I have to... Wait, no. Did Elle make me one? I didn't even update my stickers. I got so excited today. I just jumped on the live. I have new stickers. I didn't even update them today. Damn. Black excellence living on the culture in bloom. You guys have a blessed night. Continue to show up. Continue to be great. Dr. Johnson's going to go eat. I'm hungry. It is definitely dinner time. And I'm going to go disconnect and relax. Okay? This was my last interview for the month of May. May is Mental Health Awareness Month. You guys know I'm planning my next conference for the next month. I just wrapped up my guests. I confirmed all of my guests. Flyer is just about done. Stay on the lookout for that. Next month's topic is going to be interesting. It's going to be much needed. Y'all have a great night. Hungry.